Nikki M. Valdez. I'm a first-year student nurse, and for today, I will be performing vital signs monitoring and recording. Before getting the vital signs, first of all, we need to assess the patient. So the first step is to identify the client. Hello po sir, magandang hapon po. My name is Nikki po. I'm a first-year student nurse. Ako po yung nurse niyo para sa araw na to. So, base po sa medical records niyo, ang inyong pangalan ay si Mr. Detoyato.
Yes po.
Ano po mas gusto niyong itawag ko sa inyo?
Yun na lang po, Mr. Diato.
Okay po, sir. Kamusta naman po kayo, Mr. Detoyato?
Okay lang po.
The second step is to ask if the client had any food or drink or has been smoking in the past 15 minutes. Because ingestion of hot or cold food or beverages and smoking may affect the temperature of the mouth, which could result in an inaccurate temperature reading. So, sir, do you had any food or drink or has been smoking in the past 15 minutes?
No po.
Okay, very good. Next is to identify the daily fluctuations in vital signs because numerous factors may affect it throughout the course of the day. Sir, do you exercise po?
Hindi na po, halos ilang buwan na rin. Tumigil na po.
Okay po. Pagod ka po ba ngayon?
Hindi po.
Stress ka po ba this past few days?
Opo, kakatapos lang po ng exam week namin.
Okay po. Kung ina-level mo po yung stress mo, sir, from level 1 to 3, based on the intensity, anong level po?
1 lang po.
Okay po. How about, kulang ka po ba sa tulog?
Hindi po.
Okay, thank you po. The fourth step is to identify the medication or treatment that may influence the vital signs. Because many medications may increase or decrease the blood pressure, pulse rate, and respiratory rate of the patient. Sir, may iniinom po ba kayong gamot?
Wala po.
Any supplements po?
Wala din po.
Okay po. Step is to identify the factors that may influence the vital signs. It is important to understand these factors to help to ensure an accurate interpretation. So for example, today we have a hot room temperature. So this may affect the readings of the temperature of the patient. And also the age and gender of the patient should be considered. Sir, Mr. Detoyato, what is your age po?
19 po.
So ang gender niyo po ay male.
Opo.
The sixth step is to determine the baseline vital signs from patient's records. This will be done by checking the patient's chart for previously measured readings. The seventh step is to determine the appropriate temperature site for client considering advantages and disadvantages of each site. So this site should have an abundant blood supply so that the temperature of the entire body is obtained. The temperature site for the client should be on temporal, axillary, and on rectal. The eighth step is to assess if there is a contradiction for taking the blood pressure on either arm, because this will help to ensure accurate interpretation. Mr. Detoyato, have you ever experienced paralysis?
No po.
Do you have any arm injury?
Wala po.
So the ninth step is to determine the BP device and what cuff size is the most appropriate for the patient. Appropriate size of cuff must be used to ensure an accurate measurement. If the cuff size is too small, the reading may be falsely high and it may come loose as the cuff is inflated. If the cuff is too large, the reading may be falsely low. So I will be using an adult cuff size. After assessing the client, we will now go to planning. So in planning, we need to explain the procedure to the client to establish rapport and gain cooperation. Mr. Detoyato, ang gagawin ko po sa inyo ngayon ay kukuhanin ko po kayo ng temperature sa inyong temporal, axillary po, and then sa rectal.
Okay po.
Okay po, after ko po kayong kunan ng temperature, kukunan ko naman po kayo ng pulse rate and then ng respiratory rate. And then after po ng pulse rate and respiratory rate, magpaproceed naman po tayo sa pagkuha ng blood pressure nyo.
Okay po.
So wala po ba kayong nararamdaman na any discomfort bago po tayo magsimula?
Wala naman po. Normal naman po yung nararamdaman.
Wala pong any palpitation.
Wala rin po.
So, sir, magpo-proceed na po tayo.
Okay po. Thank you po.
After planning, we will now go to implementation. So the first step in implementation is to perform hand hygiene or donning of gloves as necessary or as per agency protocol. We will do this to prevent the transfer of microorganisms. So the next step is to bring out the equipment on a tray at the bedside. This will save time and energy. So as you can see, my equipment is on a tray. It is all prepared. So the last step in implementation is to assist the client in comfortable position, lying, or sitting. This is to provide easy access to pulse site and brachial artery. So Mr. Detoyato, upo na po tayo. Dahan-dahan na po. After implementation, we will now go in getting the temperature. So first is to obtain the thermometer for temporal, axial, or rectal, and then wipe with cotton balls in a circular motion from bulb to stem. In getting auxiliary temperature, we will use a digital thermometer. So the first step is to place the thermometer in the center of axilia, in the center of the dry axilia to ensure accurate reading. Next is to ask the client to hold the arm tightly against the chest and the arm may rest in the chest. And then leave the thermometer in place until you hear a beeping sound. In getting the pulse and respiration, the first step is while waiting for the thermometer to read, place the patient's hand on the abdomen while holding the wrist. Palms down using the pads of the 3 middle fingers on the radial artery. Do not use the thumb because the thumb has its own pulse to avoid the wrong measurement. Next step is plan to count the respiration after measuring the pulse. If the patient is aware that the respiration is being measured, the breathing may change. Next is to count the pulse and respiratory rate and rhythm for 1 full minute. Note the regularity, strength, and character of the pulse. Also, note for the rate, depth, and pattern, and sounds, if any. Provide full assessment of respiration and the pulse. And lastly, record the pulse rate and respiration. Remove the thermometer until you hear a beeping sound. 36. So the reading is 36.7 degrees Celsius. After removing the thermometer, wipe the thermometer with cotton balls and alcohol in a circular motion to clean off the sweat. Starting from the bulb until up to the stem.
Tapos yun.
After taking the pulse rate and the respiratory rate, we will now go in taking the blood pressure. Loosen the clothing up to the axilla because the clothing interferes with the ability to hear the Korotkoff sounds, which could result in an inaccurate blood pressure reading. Palpate the brachial artery and place the cuff snugly and smoothly, positioning the center of the bladder over the brachial artery 1 to 2 inches above the antecubital space. The position of the arm allows easy access to the brachial artery. Position the gauge so it can be easily visualized. Position and support the arms at the level of the heart. Placing the arm above the heart level may cause the reading to be falsely low. Placing it below the heart level may cause the reading to be falsely high. Direct the earpieces of the stethoscope slightly forward. And place them in your ears. Place the diaphragm or the bell of the stethoscope over the area where the brachial artery is felt. The earpieces should be directed forward, permitting them to allow the direction of the ear canal, which facilitates hearing. Pump the cuff quickly while watching the gauge to at least 30 points higher than the point at which you no longer hear or feel the pulse. Inflation of the cuff compresses and closes off the brachial artery. Deflate the cuff at a constant rate of 2 millimeters of mercury per second by unscrewing the valve on the bulb counterclockwise to prevent inaccurate reading. So the reading is 120/70. Deflate the cuff completely and jot down the blood pressure reading. Replaces patient's clothing if needed. Cleanse thermometer according to agency policy and return all the equipment for vital signs taking in their proper place. Make patient comfortable before leaving. Mr. Dutayato, thank you for your cooperation for today. See you on your next check-up po. Ingat po kayo.
Thank you po.
Thank you po. And lastly is to perform hand hygiene. Next is evaluation. Ask yourself if the results is within the normal range. Is there any alteration in the readings or the findings since the last measurement? Or is there any considerable unexplained difference between these readings and the former reading? And the last step is the documentation, wherein you will record all the vital signs and blood pressure and the temperature, pulse, and respiration sheet. That's all for vital signs monitoring and recording. Once again, my name is Princess Nikki M. Valdez. I'm a first year student nurse. Thank you.